A new partnership is in the works at a Boise hospital. It is connecting drug overdose patients with recovery coaches before they even leave the emergency department. As 6 on Your Side's Karen Leo reports in tonight's Finding Hope, program leaders say it's a crucial component to achieving long-term recovery.
Well, Dawn, over the last few months, leaders at the Peer Wellness Center in Boise have been traveling across the country to learn from recovery coach programs in other states and training people right here in the Treasure Valley to help lead people from overdose to sobriety.
We are losing way too many people right now to accidental opiate overdose.
A sad reality hitting states across the country. Emergency departments dedicating resources to treating patients after a drug overdose, many turning fatal.
Since 2009, at least 30 of my friends have died.
Lindsay Brown is a recovery coach in the Treasure Valley, hoping to slow that trend by providing support and encouragement to those patients in the Boise area.
I've worked with a couple hundred people probably.
One of the key components, program leaders say, is the coaches have a deep understanding of addiction, approaching these fragile relationships with firsthand experience.
The interaction completely changes when someone realizes you do know what I'm going through. You're not judging me. You understand, and the walls fall down. The connections that are made are powerful.
It's a program seeing success in other states, partnering people who've already navigated their way to recovery with those actively sitting at their own rock bottom.
It's real human connection. It's not fake. Because I can say to somebody, I know exactly what you're talking about. I remember feeling like that. I remember going through this. This is what I did to get out. Do you want to try this? Sometimes they say no. I'm like, awesome. What do you think is going to work?
So here's how the program will work. Before the patient is discharged from the hospital, staff will ring up a recovery coach who will come straight to the ER to meet one-on-one with the patient in private.
The best way to engage those people is to get them at the moment that they're willing.
We don't want them leaving the hospital by themselves.
Program leaders also work closely with local treatment providers to ensure when someone's ready to get help, they'll have a spot ready for them. The coaches giving them hope and leading by example.
I'm here living proof that it's not hopeless. If I can do it, you can do it. And I'm more than happy to sit with you and do it with you.
So they are still finalizing the legal logistics and the contracts. It's pretty complicated, but they have already been able to help about 20 or more patients from the hospital of opiate overdoses and help get them into programs if that's what they're looking for.
So do they go straight to the treatment programs right from the hospital?
If that's what they want, they work with these local treatment providers to have a space waiting for them if that's what they're looking for, but they're not here to pressure anybody into something that they're not ready for, because you have to want it to be able to achieve the long-term recovery. And right now they're training a handful of interns and coaches, and we're going to hear more from them and why they want to be a part of this program on Thursday morning on Good Morning Idaho.
All right, we'll look forward to that. Thanks, Karen.